Ozempic semaglutide has transformed the landscape of treatment for type 2 diabetes and, more recently, weight management, earning praise for its effectiveness and sparking excitement among patients and clinicians alike. Yet, as its use has surged, reports linking Ozempic to depression, anxiety, and even suicidal thoughts have fueled a growing debate. Does this widely celebrated medication carry hidden risks? In October 2024, a study published in Scientific Reports brought fresh insight into the potential psychiatric risks tied to Ozempic and other glucagon-like peptide-1 receptor agonist, GLP-1 RAS. Conducted by Eddie Cornelius et al., this community-based cohort study drew on a massive dataset, analyzing the experiences of 162,253 patients with obesity from January 1, 2015 to December 31, 2023. The researchers set out to compare two groups, those treated with GLP-1 receptor agonists, including Ozempic, and a matched control group of similar patients who did not use these medications. To ensure a fair comparison, the team used propensity score matching, a statistical technique that balances variables like age, sex, and health conditions between the groups. This approach aimed to isolate the effects of the medication itself, minimizing the influence of other factors. The results, however, were eye-opening and raised red flags about Ozempic's safety profile. The study found that patients taking GLP-1 receptor agonists faced a 98% higher risk of developing any psychiatric disorder compared to the control group. Breaking it down further, the numbers grew even more striking. Major depression, a 195% increased risk, meaning patients on GLP-1 receptor agonists were nearly 3 times as likely to experience this severe form of depression. Anxiety, a 108% increased risk, more than doubling the odds of this common mental health condition. Suicidal behavior, a 106% increased risk, indicating a significant uptick in actions or thoughts related to self-harm. These findings weren't based on a small isolated sample, but on real-world data, a reflection of what happens when people use Ozempic in everyday life, outside the tightly controlled settings of clinical trials. That broad scope is part of what makes this study so compelling. It captures a diverse population, including those who might not qualify for experimental research, but who rely on the drug nonetheless. Still, the researchers were careful to note limitations. Even with propensity score matching, real-world studies can't fully eliminate confounding factors, things like stress, lifestyle, or other medications that might also affect mental health. Despite this caveat, the sheer scale of the study and its alarming results have made it a cornerstone of the conversation about Ozempic's psychiatric safety, urging clinicians and patients alike to take a closer look. While large studies like the one in Scientific Reports offer a bird's-eye view, case reports zoom in on the individual, offering a human face to the statistics. These detailed accounts of specific patients have been pivotal in flagging potential side effects that might otherwise slip through the cracks of bigger analyses. When it comes to Ozempic, several case reports have raised the possibility that it could trigger or worsen psychiatric symptoms in some users. Take, for example, a 2023 study published in Frontiers in Psychiatric. It described 2 patients who began experiencing depressive symptoms roughly 1 month after starting Ozempic. In both cases, the cloud of depression lifted after they stopped the medication, a pattern that hints at a possible link. Notably, these patients weren't all the same. One had a prior history of depression, while the other did not, suggesting that Ozempic's effects might not depend solely on pre-existing conditions. A similar story emerged in another 2023 case report from PubMed Central. Here, too, patients developed depressive symptoms after starting semaglutide, and those symptoms eased once the drug was discontinued. This consistency across reports, spanning patients with and without past mental health struggles, underscores a troubling possibility. For some, Ozempic might act as a catalyst for psychiatric distress. Then there's the data from the FDA's Adverse Event Reporting System, FAERS, which tracks side effects reported by patients and healthcare providers. In 2023, NPR dug into this database and uncovered 489 reports of anxiety, depression, or suicidal thoughts among semaglutide users. Of those, 96 involved suicidal thoughts, a deeply concerning figure, and 5 ended in death. It's critical to stress that FAERS reports don't prove causation. They simply flag events that happened while someone was taking the drug. But with numbers this high, they've added urgency to the call for deeper investigation. These case reports and FAERS data matter because they spotlight experiences that large studies might miss. They suggest that, even if rare, some individuals could be uniquely vulnerable to Ozempic's psychiatric effects. For patients and doctors, these stories serve as a reminder to stay vigilant, especially when starting the medication. Not all research paints Ozempic as a mental health risk. In fact, some high-quality studies have reached the opposite conclusion, offering reassurance to those who rely on the drug. One of the most robust examples came in October 2024 with a post-hoc analysis of 4 randomized clinical trials, Step 1, 2, 3, and 4, published in JAMA Internal Medicine, led by Wadon et al. This study examined the psychiatric safety of semaglutide 2.4 milligrams weekly in patients with obesity or overweight. Unlike the real-world cohort study, these trials were tightly controlled. Participants were randomly assigned to receive either semaglutide or a placebo, and the researchers tracked their mental health outcomes over time. Crucially, the study excluded people with known major psychiatric disorders, a detail that shapes its findings. The result? No increased risk of depressive symptoms, suicidal thoughts, or suicidal behavior compared to the placebo group. In fact, the rates of these issues were virtually identical between the two groups. This conclusion was echoed in a September 2024 news release from Penn Medicine, which highlighted the STEP trial's findings. The release emphasized that for individuals without pre-existing major mental health conditions, semaglutide appeared to pose no psychiatric risk. Adding to this, the FDA weighed in back in January 2024, stating that their preliminary review of GLP-1 receptor agonists, including Ozempic, found no evidence tying them to suicidal thoughts or actions. Why do these studies matter? Because they come from randomized controlled trials, RCTs, the gold standard in medical research. RCTs are designed to cut through the noise, using randomization and placebo controls to pinpoint a drug's true effects. Their findings carry weight, offering a solid counterbalance to the concerns raised by other studies and case reports. How do we reconcile these conflicting stories, one side warning of heightened psychiatric risks, the other finding no cause for alarm? The answer lies in the differences between the studies themselves, from their design to the people they include. Population differences. The STEP trials and similar RCTs excluded participants with recent major depressive disorder or significant mental illnesses. This means they studied a relatively healthy group, at least from a psychiatric standpoint. In contrast, the Scientific Reports cohort study embraced a real-world population, people who might already have depression, anxiety, or other conditions when they started Ozempic. If those pre-existing issues make someone more susceptible to psychiatric side effects, it's no surprise that the cohort study picked up risks the RCTs missed. Study design. RCTs are built to control variables. By randomizing participants and using placebos, they reduce the chance that outside factors like stress or other medications skew the results. The cohort study, while valuable for its real-world lens, can't match that level of control. Even with propensity score matching, confounding factors could still muddy the waters, potentially inflating the reported risks. Scope and sensitivity. Case reports and FAERS data, meanwhile, zoom in on rare but severe reactions, events that might be too uncommon to show up in RCTs or cohort studies. They're less about proving a trend and more about sounding an alarm for further scrutiny. Together, these differences suggest a nuanced truth. Ozempic may be safe for many, especially those without mental health histories, but it could pose risks for others, particularly those already grappling with psychiatric challenges. This tension highlights the need to look at both the big picture and the individual when assessing a drug's safety. With evidence pulling in different directions, one thing is clear. We don't yet have the full story on Ozempic and psychiatric disorders. To bridge the gaps, more research is essential. Research that digs deeper, looks longer, and asks the right questions. Here's what's needed. Long-term studies. Most data so far covers months or a few years. What happens after 5 or 10 years on Ozempic? Long-term studies could reveal whether psychiatric risks grow, fade, or stay steady over time. Subgroup focus. Who's most at risk? Future research should zero in on specific groups, like those with past depression or anxiety, to see if they're more vulnerable and why. Mechanistic insights. How might Ozempic affect the brain? GLP-1 receptors exist in areas linked to mood and stress. Could their activation play a role? Exploring these pathways could uncover the why behind any side effects. Real-world expansion. RCTs are rigorous but limited. Cohort studies are broad but messy. More real-world analyses, paired with better controls, could refine our understanding of Ozempic's risks in diverse populations. Until these questions are answered, the debate will persist, leaving patients and providers to navigate uncertainty with the best tools they have. Who should think twice about taking Ozempic? The current evidence doesn't offer a blanket answer, but it does point to caution for some. The FDA hasn't flagged psychiatric conditions as a reason to avoid Ozempic. Its boxed warning focuses on risks like medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Still, the data suggests that people with a history of depression, anxiety, or other psychiatric disorders might be at higher risk for mental health side effects. For these patients, the decision isn't simple. Ozempic's benefits, better blood sugar control, significant weight loss, can be life-changing, but they need to be weighed against the chance of worsening mental health. Doctors should discuss these risks openly, monitor closely for mood changes, and consider alternatives if the scales tip toward concern. For someone with stable mental health, the risk might be minimal. For someone with a rocky psychiatric past, it could be a different story. Case reports reinforce this idea of individual variation. Some patients sail through Ozempic unscathed, while others hit rough waters. Differences that might tie to genetics, lifestyle, or unseen factors we don't yet understand. This variability calls for personalized care, where treatment plans flex to fit the patient, not the other way around. The link between Ozempic and psychiatric disorders is a puzzle with pieces that don't yet fit neatly together. The October 2024 scientific report study weighs a warning flag, showing real-world risks of depression and suicidal behavior. Case reports and FAERS data echo that alarm with personal stories of struggle. Yet RCTs like those in the STEP trials offer calm reassurance, finding no mental health downside in healthier groups. Each perspective has strengths and blind spots, leaving us with a complex picture. Ozempic may be a boon for many, but a burden for some. As its use skyrockets, so does the stakes of getting this right. More research, detailed, diverse, and long-ranging, will light the way, helping us pinpoint who can safely benefit and who might need a different path. For now, it's a balancing act, harnessing Ozempic's power while keeping an eye on the mind. Patients and providers should stay curious, cautious, and connected to the evolving science, ensuring this promising drug delivers hope without harm. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.